everything starts with the GnRH, the sex steroids, and in the girls, it goes from telarchy to pubarchy to menarchy, and in boys, from gonadarchy to pubarchy to spermarchy. But the interesting thing, as the previous speaker was telling, is that the ovum started ticking in utero, whereas the sperm starts ticking only during spermarchy. So the epigenetic effects are, and even in a girl, week to week variations are there in the hormones. And we know that the key players are there, the brain, the pancreas, the GIT, the white adipose tissue, which we were thinking that it has no role. Now we know that that is also an organ. And the growth hormone, the insulin, the glucagon, all these are interacting and speaking to each other and keeping our energy balance and our glycemic control. Actually, the main players are the tiny pancreas and glucagon on one side and insulin on the other side. And there is a wonderful orchestration coming with the master of the ceremony from the hypothalamo-pituitary axis. So the pancreas can sense whether we are fed or fasting, and it can release the insulin accordingly. And the growth hormone is very high during the highest and the last peak of growth, that is the adolescent period. And that is in fact causing insulin resistance. And the sex steroids can also modulate insulin sensitivity. And this is very interesting to note that there is 30 to 50% decrease in insulin sensitivity or insulin resistance during puberty. And sex steroids can modulate insulin action. And there are clinical implications of this. So in type 1 diabetes, there may be increased demands during the adolescence. That is because of the insulin resistance. And even this can shift the puberty early or late. In type 2 also, the puberty timings may be linked to the obesity and the BMI, and independent of even BMI also. So this is what I was trying to tell. That is, from the age of 15 to 17, if you look, there is insulin sensitivity is decreasing. And that is, and the insulin resistance is decreasing, and at that time the arterial stiffness is also coming down. Whereas from 17 to 24, the insulin resistance is increasing and the arterial stiffness is increasing. So are we aware of this? Are we communicating this to the children? And we see a lot of obesity is there among kids, especially adolescents, and they are totally unaware of all these things. And so when there is increased amount of fat, there is 9% risk of worsening of fasting hyperglycemia and 21% risk of worsening of insulin resistance. So what is the solution? The solution is decreasing the fat mass and increasing the fat-free mass and doing lot of physical activity. But the children don't know about this and they are shying away from doing any physical activity. 1% increase in body weight decreases the motivation for activity by 10%. So it is so much. And this is well known to everybody. Dr. Yasmin was here, one of the JPEF conferences also. So the Caucasian and the Indian, the thin fat Indian had the same BMI. But look at the fat mass, it was more than 2 times. And now the term is thinned outside, fat inside, TIFO. So I am sure that this fat mass in the Indian was only 21%. But if any one of us stand on that machine, it will be more than 30-35%. So what is the plight? And the epigenetics which was spoken about. And it is said that in the adult, 80% of what we are is because of the environment, and the 20% is only genes, because the epigenetics is acting on the genes. So that is it. And the microbes also, it was spoken about. Your diet and your attitudes, everything will change. The type of diet, the timing of eating, even whether you are cesarean, normal baby, breastfed baby, non-breastfed baby, everything is going to change your microbiota. And skin was supposed to be our largest organ, but now they say it is the microbiota. More number of microbes are there than our number of cells. So and we were thinking that if I take 100 extra calories, it will end up in 10 extra pounds. But it is not so in some people. What is the difference? Why some people are eating more and not gaining weight? That is, it is not so simple as that. The fat stores are coming in between, and it is actually the insulin who is the traffic man who is telling you spend or you go to the store. So the insulin resistance, the insulin sensitivity. So the tiny pancreas is not a small organ. And the dual control. The insulin is regulating the energy as well as glucose homeostasis. And we can see that in rural India, the obesity increased from 2 to 17%, and there was, the obesity increase was so much, and parallel to that, there was an increase in the type 2 diabetes. And when we look at our diet, the rural India, 76% of the energy is coming from carbs. And in urban, it is 71. Whereas in the European, it is only 38% is coming. Usually we say 50 to 60% of energy can come from carbs, then 20% from protein, but that is very low in our diet. That was also spoken about in the previous lectures, and 30% from fat. Then now I would say that let 40% be from carb, 40% from good fat, 20% from protein. So we have to change. And this type of diet will keep the time in range, and time restricted eating is also very important. Nowadays, the breakfast starts at 6 a.m., bread coffee ends with 9 a.m. And the dinner starts with 6 p.m., fruit juice ends up at 11 o'clock. So that always food is going in, and the pancreas will be confused, and insulin comes, again glucose goes down, and carbs we take, so there will be again craving for food. But if you take protein, you won't feel hungry also. So this was a small study which said that eating rice after vegetables versus eating rice before vegetables, there was 50 milligram difference in the blood glucose. Same amount of vegetables, same amount of carbs was eaten, but vegetables was eaten first. So let us innovate our plate. There should be a rainbow in our plate to the adolescents. We usually say that 50% can be fruits and vegetables, and then we go clockwise to the grains, then to protein. But now I would say that, let us say that vegetables be 2/3. One fruit I will keep in my green salad, so that I will have the craving to take the salad. Otherwise it is boring for me. So because some fruit is there, I will like it. The children will like it. So that proportion is changed. Then what I should focus should be on my protein. And most of them take starters like protein, and then they take a small bun, their dinner is done. But for us, it is the rice or the chapati or something is the maximum. So let us focus on the protein, and then our side dish should be the carbs and plenty of water. Sometimes I tell the kids, the Pepsi Cola is not competing with Coca-Cola, it is competing with your water intake. So we have to tell them. And Swiggies and all this was mentioned. So many of my friends also say, my adolescent kid, I cannot control as a doctor because she orders. Then I say, we should negotiate with the kid. And that is, I have a say, you have a say. My say is that 6 days a week we are going to take healthy food. One day you can order. And your say is that which day you want to order. Is it Saturday? Is it Sunday? And then many of them were coming and telling, my girl is now waiting for Saturday to come. Because they also have something to look forward to. Otherwise, if I said no, then they will disconnect from you or they will disobey you. Whatever will happen. So, your stomach should not be a waste basket, either a waste or a waste basket. And I would like to say that, so puberty is a metabolic storm driven by growth hormones, sex steroids, and the insulin is in between. And so insulin resistance is there. So we have to tell them. And the acanthosis nigricans, this is insulin resistance. Many grandparents come and say, my daughter is not bathing my grandchildren properly, that is why this. Or I am putting some thread in the neck, that is why the color. So we have to sensitize them regarding that. And the timing of puberty also matters. Need precision nutrition, regular monitoring, and psychological well-being, sleep, stress, physical activity, everything should be monitored. And so this will give you a lot of happiness also. So that we have to tell the children. And I would like to end by the quote by Eldred, who said, if I had known that I was going to live so long, I would have taken better care of myself. I think even every day I also look at this quote. Thank you very much.
Thank you so much, ma'am, for that wonderful talk.